All right, we'll call the meeting to order, everyone. If you'd all stand, Jim Tripp has the flag for us to pledge allegiance. If you'd all stand. Jim, are you there?
I'm here. I pledge allegiance
To the
to
flag
the United States of America and the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Jim. Very nicely done. The next item is approval of minutes, January 20, 2021.
I'll make a motion to approve those minutes.
Is there a second?
I'll second it.
Seconded by Rick. Any changes, errors, or omissions?
No.
Okay. There being none, all in favor? Aye.
Aye.
Any opposed? Any abstentions? Motion carries. Under number 4, for the acceptance of our agenda tonight, I do need to remove under new business, letter C, request for bid waiver for the school bus contract. The Board of Education did not meet last night, so I would like us to wait until their recommendation on this topic. They did not meet because the schools were closed, and they never meet if there's a snow day. So with that one change, if I could have a motion to approve the amended agenda.
I'll make the motion.
Ralph.
Ralph?
I'll second it.
By Jim? All in favor?
Aye.
Opposed? Any abstentions? Motion carries. Number 5, communications and correspondence. I don't have anything in particular tonight. So we'll move on to number 6, and I'll ask Nick, our host, if there is any public comment tonight. Nick?
There's no public comment at this time.
All right, thank you, Nick. The next item under old business is racial equity, diversity and inclusion, and is April here for a report? April?
She just joined, so I think she's still getting set up.
Okay, we'll wait a couple minutes.
Hey, I noticed Mike Hernandez, you're muted, at least on my screen. I don't know if, there you go.
There you go.
Yeah, okay.
Okay, looks like April has audio.
Hello.
Good evening.
Hi.
Hi. So our task force survey is done. We finished, Sunday was the last day that people could submit the survey. And we ended up with 170 surveys completed. And that is going to go out tonight to the task force members and then all the liaisons. I just have one more I have to translate from Spanish to add to the data. And then that will be going out. And then we have our next meeting will be Tuesday, this coming Tuesday the 9th at 7 p.m. And that's when we'll be going over the survey results and then planning for our community forum on Monday the 22nd.
Wonderful. Been very busy. It was a wonderful survey. I was able to take it. Thank you. Any questions for April from the committee or from the commission? The board.
No question. It's just a commentary that it's good to get 170 surveys back.
Yeah, good job.
You got a good reach.
Yeah.
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 It's a nice job.
We'll look
Thank
forward.
you.
I'm sure there'll be more work once it's calculated and tabulated. And I'm sure we'll have lots of good projects that come out of that. So thank you, April.
Yeah.
Letter B under old business is monthly budget report. And there was one sent to you. There is not too many changes. In fact, one of our staff was out for actually quite a few days. So our accountant wasn't able to do as much as we had hoped. So there'll be more information in February. But in discussions with Tom, there's really nothing outstanding other than what we've talked about in the past. We did end January, of course, with the taxes coming in. And I will add that we do have a new collector of revenue that started. Her name is Cynthia Gata. She'll be replacing Nancy DiGirolamo the middle of this month of February. And we also hired an assistant collector of revenue that will be concentrating on water and sewer payments, and her name is Devin Arce. So they started actually this week, and things seem to be going well, and we'll look forward to welcoming them as part of our team. And we thank Nancy DiGirolamo. This is the last meeting of the Board of Selectmen, and I would like to pass a motion to thank Nancy DiGirolamo for her very many years of service as our collector of revenue. If there's a motion to that effect.
I'll make that motion, Ralph.
Thank you, Ralph. Is there a second?
Chair, I'll second it.
Thank you, Jim. And it's to thank Nancy for all her hard work and to wish her well in her retirement. All in favor? Aye.
Aye.
Any opposed? Abstentions? Motion carries. Thank you and good luck to Nancy. The next is letter C, Re-Entry Committee. And
Hey, Susan,
yes,
can I interrupt for a minute?
of course.
Before we leave the budget report, I'm
Yeah.
just curious, tax collections coming in, and if many people are deferring to take advantage of that low interest, or are we collecting about, what we expected to collect or what's normal?
Didn't get a report from Nancy, but I'll turn it over to Tom to see if he has any comments on that.
Can't.
He can't,
Having
he can't.
trouble unmuting.
Nick, can you
He's-
unmute Tom, please?
There we go.
There you go. Tom, you're good.
So like Susan had said, we don't have all the collections reported in this report that you'll see. So we need to get those in. The snow day on Monday was hard on us with a quick return. So we need to get those receipts in. A lot of the big collections come in at the end of the month. There was, we're seeing a positive trend in our cash flow. Very, good, so I think we're gonna have a nice bump in Liberty's batch of payments just came in today. So it came in yesterday, and then today they got the remainder of those bills to tie that into. So that's another big number. So I think I'd say let's get the deposits recorded for January, and we'll have a better assessment in the next report that we have. We just haven't had an opportunity to get all the deposits in yet.
Okay, thank you.
Thanks, Rick. Any questions or comments on the budget report? Okay. The next is the Reentry Committee, discussion of services and programs. I'm going to have Mary Pont report in a couple of minutes for us. As you know, within the Chatham Health District, they've been conducting vaccination clinics. So Mary is going to comment on that in a couple of minutes. I did want to let you know, I heard a report from Russ Melmed, our Director of Health, today at the Chamber of Commerce meeting, which is the local East Hampton Portland division. And he said there is a good trend. While there's still positive cases, Portland in this last week went from 70 per 100,000 down to 46 per 100,000. So that's a good trend, and he said it is trending downward, which is good news. And we hope that continues. So I'll turn it over to Mary to talk about the vaccine update for folks age 75 and older. Mary Pont?
Hi, everybody. I think everyone realizes that the news is basically shaking a lot of people up because it's continually talking about COVID as well as the vaccine in our area as well as in the state, and the lack of, and how everyone can get it. We started out with working with Chatham Health District very closely, and they had their large inoculation site at the high school 2 weeks ago now, and I think it was 2 weeks ago. And when they were in the planning stage of that, we partnered with them to do a trial run for our seniors. We were getting a lot of calls from people and putting them on the list. And when we were doing the trial run, one of the things that became very apparent was that in the state system, in the VAM system, the biggest thing you have to do is go in and register by way of your email address. Well, we have seniors that don't have email addresses. We have seniors that don't even have computers. And to ask them, well, go on your tablet or go on your iPhone or go on your whatever, when they're still using their landline, has been very, very difficult. So we knew that when we did the trial run, we were only able to put together a list of people that had email addresses because it had to go into the state VAM system. In doing that, I think I updated the list maybe 3 times because people were going in and registering in the VAM system. Either a relative was entering them or they themselves somehow were registering in the VAM system. So when Chatham Health went to register them for the Portland clinic, it immediately bopped them out of the system because they were already registered in the system. So we had to keep finding people that we could register in the VAM system through Chatham Health that were not already registered. That presented quite a problem. But in doing that, we also found out how many seniors we have, certainly, that don't have computer access, or we're trying to figure out how to go on to register. As that was going forward, panic was getting hard among the seniors because they were so afraid they weren't going to be able to get in. And we went through the first inoculation at the high school. I believe they had 169. What we found was that the seniors that were coming from all over the state. They were not just coming from Portland. So all those spaces were not just for our Portland residents. They were also filled, many from quite a distance away, because some are willing to travel just to get the first inoculation. The second inoculation for that is going to be February 20th. And the people are already concerned. They can't get registered. I've been talking to Chatham Health just of today, just to see, working with them, with the system, to get some of our folks that had the first inoculation there into their system. So we're going to be able to get spacing for them. That being said, it made sense. Portland needed to do something. And certainly we, again, are working with Chatham Health District, along with the other senior centers and other towns that are in the Chatham Health District, to come up with a plan, a program. And we started with doing a hotline to call into the hotline. And I'm going to say that went live, was it 2 weeks ago on a Monday? Seems like it went live at, I'll say 2 o'clock on a Monday. The system is you call into the hotline, you leave your name and your phone number. People from the Portland Library will call you back, and they're taking all the information that's needed to fill into the Excel sheet to describe all the people that they're registering. Once the list is complete, then they send that list to me. I review it, send that list on to Chatham Health, and then we start the process of calling when we have a clinic set up. So we have our first clinic set up, which was supposed to be Monday, the big snow day. We looked at the time frame on Thursday, thought maybe it could happen. Friday, we were still hoping that it was going to be happening. We were on the phone Saturday, Chatham Health and I, discussing again, well, it looked like maybe we could make it. And then it became apparent later that it just wasn't going to. So Sunday, I split the list with Chatham Health, and we called 80 people to reschedule them for this coming Friday. So we have 80 people, Portland residents only, that are coming to get their first inoculation on this Friday. So when I said that system went live, that next morning when the library came in, they had 50 calls waiting. So those 50 calls turned into part of what are coming for this Friday clinic. Since then, the calls as I said, we've got 80 right now. We are still getting calls in right now for the last 3 days of January, because we were full, so we had to stop. Well, they're taking information, but we had to stop telling people, you're in the clinic, we have a date. Right now we're telling them we're waiting for the next date, so that they're not going to get too concerned, but we're waiting for the next date. So for the 3 last days of January, 83 calls came in. The 1st and 2nd of February, 25 calls came in. So we have 108 people as of the end of today that I have the list of on the waiting list for our next inoculation. I have been talking with Chatham Health. They are hoping by the end of next week that they're going to be able to give me an idea for when we're going to be able to schedule our next clinic. And it all goes around with how much they're going to be able to receive for, a clinic, how much of the vaccine they're going to be able to get. And I think we've found a lot of people are calling right now into the hotline that they had already had an appointment. Their appointments were canceled. We have some people that are registered for appointments, but they're afraid something's going to happen, so they want to register in Portland. So there's a lot of different calls that are coming in that are being fielded through the library and then on to me. So we're doing the best we can to service our Portland senior citizens. This is a closed clinic for Portland only, so we're not taking people from other areas, and we're hoping that we're going to be continuing with this. This model is also being set up through the district, which is East Hampton, Marlborough, Hebron, Colchester, I said Hebron, and East Haddam. So all of the towns are working on getting a system like this in place. I know Hebron was working on getting a hotline, and I think they were successful.
Okay.
After I spoke to them last week. So they were hoping that they were going to be able to do the same kind of system that we did. So it's been a little exhausting. It's been a little trying because we've had so many stories that we're all listening to, and we are trying to do the very best we can for our seniors. So, any questions?
Before I open it up for questions, I just want to thank you, Mary, as the director of our senior services, your job in coordinating these vaccinations. To think that in less than 2 weeks, we have been able to have contact with almost 200 of our residents who are 75 years of age and older, and given them not only appointments for 80 of them, but the hope of appointments for another over 100. This is the way that vaccination should be happening. This is local, this is helping, this is people within our town having contact. So a few other people that are helping, Jan Nochek and her staff, the librarians, are making that initial
Gloria.
contact. They're making that initial contact with our residents who call and leave their name and number on the hotline. So then they get a live person to call them and they talk with them. And then they get from there a call from Mary to schedule their clinic, whether it's this Friday or it'll be a notification that they'll be coming later. So it's contacting people in this very isolating time of COVID-19, which I think is so important. And it's giving people that lift that they need, that they'll be coming out of this situation. I also want to thank our technology team, Dave Kosminski. He set up the phone number right away and has been helping with any technological issues that are presenting. So it's a real team effort, and we continue to see success with this, and I hope that we continue that even as these more groups get involved. It's a much better system than the VAMS, which is a layer cake at best. I could describe it in another way, but I won't. But I don't like it at all. Rick, we'll open it up for questions.
Okay, Mary. So sort of two questions. One is, I guess you're concentrating on the 75-year-old and up
Correct.
right now?
And some
And
people are
how much-
trying to fudge their age, I can tell you that. We
Wow.
won't mention names, but yeah.
So how much longer do you think you'll be working with that specific age group before you open it up further?
I think it's going to depend on two things. I think that right now, we've got in a holding pattern 108. I'm going to foresee that we're going to see probably another 100 come forward. One of the things that I didn't mention when I was reporting was that in speaking to Russ Melman, what his hope is that other towns might have reached their capacity for 75-year-olds. They might not have as many as Portland does. And if that's the case, then if they had allotted so much vaccine for town A, B, or C, and they're not going to be using all of they felt they would need, that could possibly be put into use here in our town because our numbers are higher. So we're crossing our fingers on that. So I just wanted to interject that. We'll know that as we move along.
And ultimately, Rick, it's the governor's decision as to the prioritization and who comes next.
Yeah.
The same meeting I mentioned earlier with the Chamber of Commerce, Russ Melmed anticipates the 65 and older may be within that next priority, but that is a tremendous number of people. So compared to the 75 and older, I think we have about 700 to 750 is our estimate of 75 and older in our town. Many of them may be going elsewhere, but that's what Ryan Curley told me was on the voter list.
And they have gone elsewhere. Just recently, good stories about how they were able to connect, because what's been happening, obviously the system got rolled out, the VAM system got rolled out with immediately flaws with the system and trying to keep it running. The 211 number was changed into an 877 number. When that happened, people were calling and either getting hung up on, or they had to leave their name and number and never got calls back. Well, now there's a few other numbers that are in now in works and are working well, apparently, because I've had reports from a few of our citizens when I've called them back to schedule them that they had actually called in, they had gotten a call within a couple of hours, and one person in particular got registered the very next day to go to Rensselaer Field. She had already had, because I talked to her on a Wednesday, this happened on a Tuesday, she raved about their system up there and how smooth it was. That was not the case to begin with. So as it rolls out, it's going to, all the little bugs in the system, I'm hoping that they're going to be worked out. And I know the state is recognizing that. And I certainly know the state level of senior centers is recognizing that. So.
Are you referring to the VAMs when you
Yes.
made that comment about Rensselaer Field? Okay.
Yeah.
The clinic you mentioned that was at the high school.
Yes.
Was that part of the state program, the VAMs?
Yes, run by Chatham Health.
I see. And what you're doing is run by?
It's a closed clinic, work jointly with the town of Portland and Chatham Health.
Okay.
And
okay.
The other towns in the district are modeling that same system. So they're closed systems just for the citizens of their town.
Like it, you know, it's run a lot smoother. So well done with that.
Now they're worried about their hairdos getting ruined on Friday with the rain.
Yeah.
Yeah.
Well,
heard that a couple times today.
Rather have messy hair than
I know.
the virus.
I keep telling them the drowned rat look is in. So, you know, that's a little better than worrying about the snow. But
I find it interesting, and then I'll yield, that I have friends in other states, New York, Florida, Texas. And in those states, people 65 that I know have been able to get vaccinated,
Mhm.
which is kind of interesting that, I don't know if because they're bigger states, they're getting more vaccine, but it seems like in Connecticut that there seems to be a real shortage of enough vaccine to go around right now. Either that or we have a higher proportion of elderly of our population base, but
I think part of it was the rollout, that the state had a definite system in place to roll out and make sure that we did the first responders first, all of the hospital workers first, our fire department, our police department. Then they went to the next level of the convalescent homes and did all of the convalescent homes, from my understanding, in the state of Connecticut, as well as the people, the workers there who were willing to get a vaccine. Then it went to the 75 and up.
I see.
So,
So ours has been more of a stepped approach.
I think so.
Yeah.
I think so. Where it seems like in some of the other states, and I'm talking to the people in other states as well, and they can't get a shot. They can't get into the system. They're having difficulties. It also depends on how old your computer is. If you've got a computer that's 5 or 6 years old, it's probably not going to be able to talk to the system that's the healthiest, speediest
No.
system, that's out there. So, I think it's made a difference for us changing that people can call to be able to get our people. And I know that when we get the 65 and up, that age range is going to be more computer literate. They're going to have their tablets. They're going to have the means to be able to go in and get registered.
Okay, thank you.
Thank you.
So,
Any other questions? Ralph?
yeah, I just want to make a couple comments. I think it's great the way we're approaching it, because what you see is, in fact, I was watching news while I was eating tonight, was they're seeing that there is an inequity of where the vaccinations are going, and it's largely probably contributed to the fact that people may not have access to emails or computers. And so we're obviously proactively attacking it from that end and trying to take care of it. And I will say, the university I work at, we have the same situation. And you have employees that have email addresses, and just because they have an email address doesn't mean they actually use it. It may be they got it when they came to the company, but they don't have a reason to look at email. So we have struggled with the fact is, how do you get to reach out to these individuals when they're not necessarily looking at email to see that they got invited? So it's great that we're being so proactive to attack it. It's, and to Rick's point, talking about the groupings, it's just the nature of how the state is rolling it out. They had a methodical approach, and that was their ordering. I mean, we're sitting on our 65 to 74 list, just sitting on it because they haven't given the go to go with it. So it's just going to be laborious, but again, it's methodical. And we sit and wait to see what's going to be the definition of frontline essential workers and stuff like that. So still more to come from the state that really helped push it along. But we didn't get to all the 75-year-olds yet, so there's no reason to move on to the next group when you haven't completed the previous group. So I just wanted to say, it's great what we're doing.
We might need about 5 more people making calls if we go into 65 and up with all the calls that are coming in. So
Well, like you said, they should.
and hope for no more snowstorms on weekends. That's, we don't want to do that.
You would expect that age group's going to be a little more computer literate, so you're not going to have the same challenges. And that'll continue as you move down the spectrum, so.
And as I said,
I will say that this system, Ralph, works a lot better than the VAMS. I mean, the VAMS is possible, but it's a federal system. And if any of you have ever worked in federal government with federal programs, they're complicated. And there's double identifiers and verifications and going back and forth and so forth. While it is a system and Connecticut decided to go along with it, it is by far not the best system. No matter how computer literate you are. I talked with a lady today, and she was struggling with getting her second vaccination, as Mary was talking about. And every time she goes on, there's no clinic open. They're all filled. So she's going for her 10-mile radius, and she can't find it. And she said, I'm just thrilled that I got to the appointments screen because I couldn't get to the screen earlier. So it's a very complicated process if you haven't used it. I don't think it's user friendly, and it's certainly not the best for people's stress level. I mean, being able to actually talk to a town employee and then be able to have their appointment made and be able to have just that level of work, I think is very appropriate, particularly during these trying times. So I would advocate that we continue with the system if at all possible.
One of the other things that's going to happen on Friday, when they leave, before they leave the building, they're going to have a card given to them that's going to have the date and the time, and it's going to be the same time that they came on Friday. So if they came at 2 o'clock, they're coming back at 2 o'clock. And the next, for the second vaccine, is going to be March 5th. That's on a Friday. So it's going to give them something in their hand, and I have a feeling we're probably going to call and remind people, but in their hand to take with them. Because I think that was not, I don't believe that happened for when they had it at the high school. I'm trying to get a little feed on that. I thought they had already told people when they were leaving that when the next vaccine was going to be. I know they announced it after the fact, but people are into, I mean, I talked to a woman who drove to Terryville, a Walgreens in Terryville, for the first one. Now she's trying to figure out how to get the second one. A senior, one of our 75 and up. So people are doing the best they can. I think the state, again, has rolled out more phone numbers. I know United Way, Connecticut-wide has jumped on board with additional phone numbers because they have the 211, and that was being effective, and that was crashing, and then they went to the next level. But when they can get a person who that person can actually give them an appointment, and the phone numbers they're calling now can do that versus trying to go through the system and register themselves. That's the hard part.
Any other questions, Selectmen? Rick?
Just one more quick question. Will you continue with this format when you say go to the next level, the 65-year-olds with this?
I think that's probably a decision that we're all going to sit down and talk about, and talk with, certainly with Susan and Chatham Health. And if it's going to be a workable system for our town to continue having a closed clinic in our town for our town residents, then I'm certainly willing to do it. But I think we need to see if, Chatham Health is on board with that. I have a feeling they might be, because this has been really a major team effort to have this successful clinic happen. In spite of the weather, I think it's been very successful. And we were having it on Monday, which was a day for the food bank. So they actually they made the decision before this, they knew about the snow to cancel that day. They didn't have a lot of requests that day for this past Monday. But we're now making sure that we're going to do the clinics on either Friday. So we're not disrupting them, because it's going to be at the senior center. We're going to leave the upstairs set up as long as we can. The TV studio was moved just recently. So you'll all see it at another time, I'm sure, in another location. I guess it's being kept secret because I don't see anybody in that TV studio. But that was moved. So the large room at the senior center is now going to be remain set up until we know that we don't need it any longer, or we're going to start opening the building. So we'll be doing rent rebate applications starting the middle of April, and that's just a one-on-one thing. But yeah,
I was going to say we'll keep everybody up to date, Mary, as we get more information. Good report. If there's not any further questions.
Yeah, I just had one quick comment, quick question. But one, first of all, thanks to you and the team for making that work. It makes a big difference for everybody. You can't say that enough. But I assume that they're probably doing the Moderna vaccine.
Yes, they are.
Okay.
Yeah.
Thank you.
That's
Anybody else?
28 days for the second one.
That's why I was curious. I know it's 21 for Pfizer and 28 for Moderna.
Yeah.
Okay.
Anyone else? All right. Thank you very much, Mary. Good report. Good work.
I think I'm going to leave you all so you can all get back to work.
Okay. Have a good evening.
Have a good night.
Thanks.
The next item on our agenda is the digital speed signs. Ralph had asked for this, and I did email out to everyone the data reports that had been given to me by Bob Shea. And I think you'll see that if you look at the page that talks about the average speed, it's actually better than it used to be. I believe the most 91%, I'm looking Ames Hollow, 90 on page 5 of 8. 91% of the traffic is going below 40 miles per hour, which is good. And if you look at the High Street numbers on page 5 of 8, 94.82% are going below 40 miles per hour. So the numbers were higher before. I don't have the first set of numbers, but this is a compilation of August 4th through January 21st. I do think they're effective, and I do think that most drivers are slowing down when they see their speed and realizing they're going too fast. It is an effective tool. Ralph, did you want to make some comments?
Yeah, I guess, the challenge, obviously, I don't remember we had previous conversations about those areas when they've been up for discussion to talk about average speeds. It would have, it's good to know if those, I know you're saying you have what you can recall that we are seeing.
We have the data. I just don't have it tonight.
Yeah, no, I realize that.
And Bob Shea is on if he wants to comment after you.
But I mean, I think that's critical because, it's something we could certainly take a shot at and trying to do something strategically with Main Street. The only challenge on Main Street, because I know I was thinking about it the other day driving through it, is that it changes so many times the speed limit. So I'm not quite sure where you'd consider to be the optimal locations for them. But I would guess maybe you'd probably do it maybe around the school areas because you'd be them to be most conscientious around the schools. But yeah, this is good to know. I don't know what else. I know we have to obviously go try to get a sense of how much this would cost. Obviously, we did this a little while ago. So are we going to get some pricing? And I know it gets more complicated because the state will be involved with this. But
is Bob Shea available? I think you're on the call. Did you want to make any comments, Bob?
Yeah, I'm here, Susan. Can you hear me?
Yes.
So hello to all. Yeah, I've been studying this since we put we had the opportunity to put those speed signs up in the locations that we previously tracked with some of the work that Susan did with, I think, the regional speed. They were doing some analysis. So we tried to track the areas that we felt were, of the 2 roads that we put the speed signs on, the areas that, number one, we thought were the speed increased because of the length of travel on the roads, and also in the areas we felt that there were some hazards. Also with that, and probably most important, was they are solar powered units. So we certainly had to find the optimum place for sunshine on Ames Hollow, which is not too many areas. And we picked that area that we have, which fell right into the area of study related to speed. So that worked out well. Ames Hollow, definitely an improvement. It was obvious that before there was a sign up there, we had speeds that were well in excess of 40 miles an hour just from, normal patrol. The area of High Street was selected because of the crash data that was studied related to exiting from Fairview. That's another good area for solar as well, and we've seen a decrease in speed in that area. If you were to sit out on High Street, which I have done, motorists approach that sign and it flashes red, all you see is brake lights. And that's exactly what those signs are meant to do, is to alert you to a speed that you're probably not looking at because you're just driving, and it alerts you, and then it creates you to take notice of your speed and slow down. So I think they are absolutely working in those areas. The prices of those units are high. And I think the prices probably since we put those in have gone up. So we would have to certainly research the type of signs if you were looking to put them in other areas. And if Main Street was one of those, that certainly would be an encroachment permit through DOT to be able to put that just like any other sign you would have to do on a state road.
So we'll continue with looking into it, and we'll get back to the selectmen on that.
I have a quick question for Bob, if that's all right. The data that is gotten from these signs, looking at these graphs, right, which is, it's good. It looks like, 99% is under 45, and then just shy of 98% is under 45 on the other signs. So that's definitely helpful. Can you break, does the data come in a package where you can break it out enough to get an idea if there are certain times of day when you see people speeding more frequently than other times of day? In other words, is there any way to use the data to try to figure out if we were going to try to have a couple of patrols that they could be targeted, so that officers are spending time when it would be most productive to be out there taking a look at it?
Yes, there is. The software that we're using gives an awful lot of data that, is somewhat confusing if you're not used to looking at it, but it not only grabs data during time frames that we obviously have to program this off because we want to charge the batteries as well. So there's periods of the day that the sign doesn't work and periods that it does, and that's primarily during high traffic times that we've set those. But yeah, we have that data, Jim. We would just have to pull it for you to look at, and it's also in different directions too as well at times.
Oh, excellent. Thank you.
Any other comments? Okay, so we'll continue to get some more information and bring it forward to you. Letter E, appointments to boards and commissions or reappointments. Jim?
Just have one tonight. I'd like to make a motion that we appoint Victoria Short as an alternate to the Zoning Board of Appeals.
Is there a second?
I'll second that, Ralph.
Thank you, Ralph. All in favor? Aye.
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 Hi.
Any opposed? Any abstentions? Motion carries. Thank you. Under new business, Municipal Coronavirus Relief Fund for the Chatham Health District. You may recall, I may have talked about a Coronavirus Relief Fund money that came from the state of Connecticut to the town of Portland, came to every town. And those dollars can be used for public safety and for public health districts, as well as other COVID-related specific matters. And the town of Portland, along with Colchester, East Hampton, East Hampton, Hebron, Marlborough, as you know, we're all in the Chatham Health District. And Russ Melmed put together a request for 20% of each town's allocation from a particular grant. And the reason he's coming to us is because there is no separate grant for health districts or health departments. If that were a department within our town, it would just be, a matter of spending those dollars associated with the health department. But because we're a district, we would have to allocate those dollars to then go into the full district budget. And he prepared for us a list of what the dollars would be spent on. And I'll briefly go over them with you. So from the 6 towns, for contracted vaccine clinic coordinator and volunteer manager, he needs $42,120. For a COVID-19 response coordinator, $14,314. For clinic staff overtime, $29,952. Clinic food, $1,820. Mileage, $2,912. Laptops and technology, $2,000, for a total estimate for 26 weeks of administration of the clinics $93,118.30. And that's a little less than what he's asking each town to contribute. Of the $66,000 and change that the town of Portland received, 20% would be $13,336.40. I believe most of the other towns have already met with their elected bodies, and they have agreed that this is appropriate use of this COVID relief fund money. These clinics are not free, even though we're not charging our participants. Some of their health insurance is helping to defray some of the cost, but some people that are coming, if they don't complete the insurance information, they're not being charged, and especially those that may not have health insurance. So I am bringing this to you for discussion and endorsement that we contribute the $13,000 and change to the health district. So I'll turn it over for comment and questions.
I mean, we just got a good report on the good work that's being done with these clinics. I think this is important. I would certainly endorse us paying our portion of keeping that going.
Thank you, Jim. Anybody else?
Yeah, I would say, if I recall, I remember seeing in the other sheet that talked about each town, and I thought that it looked like it tried to do it in some manner that may have suggested the level of use that each town may have. It wasn't divided by 5 because there was 5 towns. I thought it was somewhat divided differently, so that would suggest they made some sort of an evaluation of use of the services, right? It wasn't all.
Well, each town receives a different population-based allotment. So Colchester receives the most. They receive $126,769. Portland receives the $66,682. The lowest figure is Marlborough, which has the fewest number of people at $44,618. So then he took a straight 20%
Okay.
of what that allocation was. So I think what you were maybe referring to is the fact that each town gets a different amount based on its population. And that's the way we pay the fees to Chatham Health as well. You pay on a per capita basis. So we're only being charged the percentage of the dollars.
Jim's putting it up to the screen. Thank you, Jim.
Susan, it's Rick. The allotment monies that each town got, did that come from the state?
It's COVID relief money, but it came by way of the Office of Policy and Management. Yes.
Okay, and
But
did
it's
we?
not state money. I believe it's federal money.
Federal money, okay, right. But we received it? Have we received it? Or are we kind of waiting for it?
No, we have received it, correct? Is Tom still on the phone?
Tom's nodding.
Okay, yes,
Okay.
we have received it, yeah.
So, yeah, I would say the way he did the math, it's fair. He took the total allotment of the 6 towns. 20% of that is the 93,000 that he needs. And then he's just charging back each town their 20% of the town's allotment. I mean, it seems the fairest way to do it.
Yeah.
So
And I can attest that, the staff at the health district are working very hard, and they've been working extremely hard, carrying on their normal activities for septic and wells and, all the various duties that the sanitarians have, as well as appropriate inspection of restaurants, eating establishments, and then enforcement of COVID as well when they visit, when there's violation complaints. Add to that now the vaccination clinics that they're coordinating and are responsible for. So I know that they're working very hard. I know that they're working overtime, and adding this extra staff is absolutely necessary. So I think it's an appropriate, healthy use of these dollars. And the more that we can have these clinics that Mary Pont was explaining, I think people truly appreciate the work of Chatham. Concur.
We want to put in the form of a motion?
That'd be great, Jim.
All right, I'll make a motion that we allocate the $13,336.40, which would be 20% of our allotment, as our contribution to the municipal coronavirus relief fund for the Chatham Health District.
For Chatham Health, yes.
I'll
Is there a
Second
second?
it. Second.
Thanks, Rick. Thanks, Rick. Further discussion? All in favor of the motion? Aye.
Aye.
Anyone opposed or abstaining? Motion carries. Thank you. And we'll continue to keep you updated on progress with the vaccinations. The next item is something that Chief Shea will be discussing, and you have a resolution in front of you for some work that the fire department is doing in applying for a FEMA Assistance to Firefighters Grant. Bob Shea?
So here I am again. This is just the preliminary. We're ready to apply for another grant. As you remember, we just received one, which was a huge win for the town of Portland and the residents, $210,000 savings for the replacement of our air packs. So as we continue to research our needs each year and do our study, our radios are next. Radios around us are changing very quickly to new technology. Ours is just about 20 years old and already, which is amazing, which was offered to us in a grant back when we first changed over our radio system. So now it's becoming aged. We're having difficulty getting replacement parts for some of our radios. So now it's time to start thinking about changing over our emergency communication. So we have drafted a grant with a huge amount of help from Nick Dijon, who's been writing grants with me now for about 2 or 3 years. And we're ready to apply this week for about a 500 and change, 525, I don't have the number in front of me, $1,000 communication grant to revamp our entire emergency communication through the fire department to an 800 megahertz system, which most of our regional mutual aid partners are changing to as we speak. So we're looking hopefully for a successful bid at this. There is a 5% match, as there always is for the AFG grant, the Assistance to Firefighters grant. So we present to you, before we go and ask for money, the approval to go and do that.
Because there is the match, that's why we bring it to you.
Correct.
And I believe I sent a draft resolution to you. Do you have it?
I missed that.
Yeah, I don't have it in front of me.
I have it in front of me.
You do? Okay.
Ralph, please?
You want me to read it, you said?
Yes, please?
Sure.
Yes.
Resolution before the Board of Selectmen, February 3rd, 2021. Authorization to apply for assistance to firefighter grant, portables and mobile radios. Whereas the Portland Fire Department is in need of new and compliant portables and mobile radios that can be used by the fire department. And whereas the Federal Emergency Management Agency, FEMA, offers grants for assistance to firefighters, CFDA number 97.044. And whereas the Portland Fire Department wants to apply for a grant in the amount of $525,134. Federal share of grant is $500,128. If awarded, the town of Portland would need to provide a match of 5%, amounting to approximately $25,006. Match funding would need to be set aside at a future date. Now therefore be it resolved that the Board of Selectmen of the town of Portland hereby approves Susan S. Bransfield, first selectwoman, and or her designee, Fire Chief Robert Shea, to apply for, sign, and execute any required documents for the grant process.
Is there a motion to approve this resolution?
I'll make a motion to approve that resolution as presented.
Is there a second?
I'll second that.
Thank you, Lou. Discussion?
Just great program. Let's hope we have the same success as we did with the breathing apparatus.
Definitely.
I agree. And thank you, Bob, for your presentation. All in favor of the motion? Aye.
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 Any opposed or abstentions? Motion carries. Thank you very much.
Thank you all.
You're welcome, Bob.
Thank you, Bob.
And Des, you,
Bob, or Steve, before we leave this, when might we learn that the grant's approved, and when would the town have to come up with their portion of the money?
So the process it seems to be speeding up each year. I don't think that we would know anything until sometime early summer. It could be sooner. So this would be something that we would have an opportunity to discuss if awarded. But once the award comes to my portal through FEMA Go, we have about 30 days to make a decision either to accept or not.
So what I'm thinking is then we're gonna need to budget for this, right? For next fiscal year? Or have it in contingency, or somehow, sometime after 30 days after we get awarded the grant, the town has to.
So that
Okay,
will
there.
be, yes,
Yeah.
you're absolutely right. And that will be part of our budget deliberations. I have that on my notes.
Okay, great. No, that was it. I just wanted to get a handle on the timing. So, thank you.
thank you, Rick. Thank you, Bob. We're not doing letter C, so C becomes the refunds of excess payments. Jim?
Sure, I'll make a motion that we refund the amount of $602 to A-Car Leasing LTD.
I'll second that.
Seconded by Ralph. All in favor? Aye.
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 Any opposed? Any abstentions? Motion carries.
I make a motion that we refund the amount of $3,369.24 to Aaron Eaton.
I'll second it.
Thank you. All in favor? Aye.
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 Any opposed? Any abstentions? Motion carries. Number 9, status and committee.
I'd have something relatively quick. Yeah, as we discussed earlier, the Board of Education didn't meet last night, so I don't have anything updated from that venue. Just an item from the Water and Sewer Subcommittee. We're continuing to meet. We're going to be meeting again on February 16th is our current schedule. Working on a couple of things, but probably the most dominant right now is really trying to keep continuing to push forward on this need for us to get alternate water source and to have time to get that done online. Along with that, I know that we've been somewhat hanging on with releasing a bid for the test wells because we need to see how that's going to interplay with the $250,000 grant we received from the Department of Public Health. I guess my question with this, Susan, would be, have we got any additional information from the Department of Public Health on that grant, the release of the funds, the rules of the road associated with it? And is it possible for us to get a meeting together with Lori Matthews and talk about, and really kind of talk about that and kick it off?
Sure. I do not have any update from Lori, but I certainly will get in touch with her. And I'll let you know of a meeting with Bob and other members of the Water and Sewer Subcommittee so that we can meet and talk about this. It may end up being a Board of Selectmen meeting because there would be 4 of us, so others would be encouraged if they can attend as well. But I will get back to you as the chairman of Water and Sewer Subcommittee so that we can move ahead on this. I think it's a wise request and we'll proceed.
Thank you.
Thank you. Thank you, Jim. Anybody else under status and committee reports?
I'll probably just give a quick update. The library board of directors had their meeting last week. Certainly there's always at this time lots of discussion about how creative they've been or how their services are within the constraints of what they're dealing with. And they continue to see activity and usage of the library, which obviously is great given the situation. And the other half of the discussion really centered around of just trying to explain what the budget tentatively could be for the new budget year and what they're asking for and including any capital some discussions about any capital projects that would come out of as well. So for our, our annual budget work.
Thank you. Any other reports for us tonight?
I have a report, Susan, on just an update. And this is the Clean Energy Task Force. Andy Bauer and you and I have been working on the solar array at the transfer station. And tomorrow we do have a phone call or phone meeting with Alan Sabin from the Green Bank to talk more about a report on his findings of the feasibility of a solar array at the transfer station. The other thing I was going to mention is that the Airline Trail Committee had a meeting the other day, and we talked more about the memorandum of understandings that we've worked through you and our attorney, so that these memorandums of understanding can be sent out to all the landowners in phase 2 of the Airline Trail. And hopefully we can have a timeline estimation that if in fact we can get these back from the people by spring and their approval, that would make us be able to apply for a DEEP grant. And DEEP grants usually start around September. So if we could get that going over the summer, get it ready, present it in September, and then usually, I know they had some grants that they gave out in January this year, but usually it's like February or March. But if in fact grants are awarded in the winter of 2022 and we get one, we could then go out to bid in the spring of 2022, secure a contractor maybe by June of that 2022, and have the work done possibly by maybe the winter, maybe December 2022. Those are all estimates, and we don't know how those will work, but our goal is that we can get phase 2 getting ready. That would take us to Route 17, where the new Dairy Queen is being built, which would be a great opportunity for all the businesses, but more so for Dairy Queen, and also the people that would like to continue on the bike trail or the hiking trail. That would bring them from Route 17 all the way to East Hampton. And then East Hampton, where there's discussion now that Eversource is going to move the poles that is in that wet section. And that would provide an opportunity to put a boardwalk over the water that would send us right through East Hampton all the way to Willimantic. So stay tuned to see if where we are, but that's the update.
That's great. I will add to the clean energy efforts, and that is I did have a phone call with the successful bidder to put the solar panels on Brownstone Intermediate School roof, and they are coordinating with Carl Johnson as our facilities manager, as well as Charles Britton, our superintendent, and those panels will likely be on before the end of the fiscal year. At least that is the hope. So that'll be good. That'll save our schools some energy costs, and it's a very favorable contract that we have signed with the Green Bank. So we're very happy about these initiatives. Any other reports from any other selectmen tonight?
Just comment to Lou that even in the depths of winter, I'm often on the rail trail along Middle Haddam Road, and it's amazing during the week, even late afternoon, whenever I go out there, there's people out there.
Yeah.
That trail is really getting used in a good way. And I think if we could expand it, it'd be great, and get people walking more in the part of town where we have commerce going on, that it could even help our local businesses. So keep up the good work on that. I really enjoy the trail.
Yeah, I think we all do. Thank you for that. It made me remind me that I was by there today, and I noticed that the parking lot next to Jim's house was plowed. So, and there was tracks for cross-country skiers that already were using the trail 2 days after the storm, and it looks like there were some footprints there as well for people that are hiking and walking, and maybe snowshoeing. So thank you to Bob Shea and his crew for clearing that out so that people can park their cars and get access to the trail.
Thank you. I'll ask Nick a comment.
We have no comments.
Thank you, Nick. And general informal discussion by the Board of Selectmen.
I have another question for Lou, because I haven't talked to you in a while. Have you heard anything back from Tilcon?
Not yet. I have to talk to Susan again. I know that we do have some maps that that Jacobson had given us, and we just have to draw a line from, an estimate of where we think the that entryway could go. That would be adjacent to the Meriden Boatyard, and in doing so, we can get that done. I actually have a black and white printer. It looks better on color, so I'll talk to Susan and we'll get that done.
Very
All
good.
right, thanks, Lou. And if you want to have any other discussion on that, sometime we can always talk or have coffee and discuss. But
Coffee's always good.
okay.
I have nothing on follow-up items tonight. So I will entertain a motion to go into executive session for the purpose of possible land acquisition, possible sale. So I need a motion to go into that session. Is there a motion?
I'll make a motion that we go into executive session.
Jim, is there a second?
Second, Rick.
By Rick Shar. All in favor? Aye.
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 Any opposed? Any abstentions? Motion carries. So Nick will be putting us into a private forum, and this would conclude the public portion. And I thank everyone for attending. So if you could just bear with us for a few moments.